do that, I've thank you for recording this. For us, what we need to do is to figure out how do we get there. Well, the good news is there are people like Clint around that have done this kind of work before, and we can learn from them. And so what I've been doing as my role, which is a consultant role, I'm getting paid to help lead the state to a point where we can really have good conversations and maybe even adopt more data to drive our culture. So as a consultant, I've been looking to see how other people have done this. There are best practices. There are people that have done this kind of thing before. So let's learn from them. And from there, my suggestion is that we create a vision. What are we trying to do here? What are we trying to create? And how do we get there? I think it'd be relatively easy for us to start to describe where we are today. But if what we want for tomorrow is a data-driven ecosystem, we need to learn from others. And so what I have proposed to Susan is that we walk down this roadmap together, that we figure out how to do this based on how others have done it before us. We tweak what has worked for others so that it fits for Wyoming, and that we maybe make some big systemic change, little by little, of course, but make some big systemic change. To do all of that, what I'm going to need to do is to have all of you on the same page, a consensus of sorts of how we're going to get there. And so I developed this roadmap and this idea of creating a vision for where we're trying to get. And I want to walk you through those first steps today, because quite frankly, we've talked about it enough. It's time to get to work. And what I want to do on a more regular basis is maybe share with you some of my initial findings as I've looked to see how other states have done this, share with you some preliminary work of analysis. Here's where we are compared to where others have gotten, and maybe start to build a team that can get Wyoming there. And as we work through this process, I thought it would be helpful for me and maybe for you as well to maybe review what others have done and to maybe spend a few minutes, and I'm suggesting 15 minutes maybe each time we get together, where we have an educational piece and we look to see what else is going on out there, or we look to see what it means to develop a common intake. And so what I want to do with you guys now is share with you an initial piece of that educational component. This is something that I hope helps us all to reach a consensus point more easily, but it's also materials that I hope Susan is able to bind together in some form to eventually come up with a training manual. Here's why we're doing what we're doing. Here's how it works. And eventually that could and should lead to, some not just common intake forms, but some common processes and common policies. And so let me jump into this and share with you my screen and walk through some of that. Anybody have any feedback initially as I pull this thing up here? Well, hearing nothing, I'll just jump right in then. And basically what I think we can learn from others
Joe,
is
just so you know, we're seeing your presentation window, which is fine.
You can probably do the drop down on display settings. Yep.
Swap.
interesting. So it gave you my presenter view.
Yeah, we're good now. Thank you.
Well, I didn't know that. Well, thank you for pointing that out. So yeah, basically what we want to do is to look to see how other people have done this. And basically what they've done is the same thing. They've come up with a vision, an idea. Here's what we want to be doing. And then they've looked at how others have done it. And typically that means looking at some kind of a framework. There are people that have mapped out the CSBG world and the health world and whatnot. And we can use those to help us define our vision as well as help us figure out how we're going to get there. And so first thing I want to do with you is to share with you some of the work that's been done out there with a thought in mind, and that is, why are we doing this? Why do we really want a data-driven culture? And as I thought about this, and as I looked at what others were trying to accomplish, they're all trying to get better at what they do. They're all trying to improve. And that improvement comes in the efficiency of how they do things, or perhaps in the accountability, transparency of how they're doing things. With data, they become better communicators. They become more focused on outcomes, and of course, implicit in that is that we all become more effective. And honestly, what's been driving me through this whole process is, for the 20 years that I've been working on Wyoming CSBG program, it's making me nuts. There's no connected strategy. There's no way to connect needs with resources with an objective analysis that consistently works. There have been some hits and misses over the years, but all of these things need to be improved. And so when we come up with a vision for what we're trying to do here, I think it should answer this question. Why are we trying to create a data-driven culture? Well, we're trying to create some systemic change. And that systemic change, we're hoping, will improve all of these various aspects of what we do. And so when you think about it that broad, and you think about how do we help people, what do people need in order to be healthy and to thrive? This is a conversation that's been going on longer than I've been alive. I mean, when I went to college, we studied things like Maslow's hierarchy of needs. Maslow took a look at what it takes for humans to develop, and said, we all want to reach this point where we're on a higher plane, where we have faith, where we feel good about ourselves. But before we can get there, we have to address our physiological needs for food and shelter. We have to be safe. We have to belong. We have to have these things. And so when we talk about how to come up with a framework for human development, this is one of the first ones that's out there. And it's one that people my age learned in college, and it's one that still has some use today. But Maslow's hierarchy of needs helps us look at all of the different factors that are needing to be addressed in order for people to move forward with their lives. Nowadays, we've taken those initial thoughts of Maslow's and really started to massage them into broader categories of what it takes to be healthy and for our ability to thrive. And so Community Commons, a group that does a lot of CSBG support work, came up with these 7 vital conditions for health and well-being, talking about, thriving in our natural world, our basic needs for health and safety, housing, work, money, income, assets, education, transportation. These look a lot like the CSBG domains, don't they? And that's because it's a framework that addresses the CSBG world. And so this is a good framework. In fact, the folks that run Community Commons, a group called IP3 or IP3 Assess, has used this framework to come up with data indicators so that people that use that framework can keep track of those data indicators and recognize when there's a change or when there's a need to do something. And so this IP3 suite of data frameworks is, I'll just tell you, outstanding, but it's also expensive. What this group at IP3 did is they took those 7 vital conditions of health and well-being, and they started to map them out. They started to map out data indicators for each of those conditions. And that's kind of what we're talking about here. How can we start to gain some insight and gather data on each of the CSBG domains or whatever framework we use, like this one? And these folks have done that work. And so if we're trying to figure out how well we're doing with housing, we can look at some objective things. We can do subjective surveys with people that really need housing or that have immediate needs. We can talk to 211 about what those current needs are, but those are the things that you look at. And that's how a framework can help us here by helping us to understand a bigger picture, how we help people, and then understanding how we keep track of those various domains. This helps. And many other CSBG groups have looked at this kind of stuff. More important, perhaps, here in Wyoming is that we've recently been talking about another framework, one called the social determinants of health. And I know, Susan, you've covered this at the last couple of conferences. Casey, I know that you guys are focused on this for your CommuniCare initiative. And here again, what we have is, kind of a model of how we help people, what they need in order to get ahead, or as the health industry has called it, what those social determinants are that have a huge impact on everybody's ability to get ahead. And here again, in fact, we can take those categories and we can start to identify data indicators for each one of those to figure out how are we doing there. And so here again, the same kind of process. Let's map out what people need. Let's then start to figure out how we can get a handle on how people are doing in each of those categories. And these are the kind of data indicators that are used with the social determinants of health to get there. And so this is a second model of helping people that we can think of. I really like it. I really like the social determinants of health because it also allows us to look not just at our little niche within the CSBG ecosystem, but the whole thing. It understands the concepts that some of the things that we address upstream have an impact on people downstream and vice versa. It starts to look at approaches that include collaborative efforts of whole of government, where the local folks, state folks, and federal folks are all working together across sectors trying to drive community improvement. And so this model is actually one that I think we should probably be following. It's cohesive. It ties those upstream social determinants of health with how we're actually doing on an individual basis. It makes a lot of sense I think to everybody on this call. And in fact, it's also something that the federal government continues to invest in quite heavily. You've probably heard of the Healthy People 2030 initiative. That's a big deal. And we're at the federal government level, we're really looking at whatever can be done to pull together data to focus more attention on these social determinants of health so that we all become healthier. This has some muscle behind it, and it's going to be something that I think we're going to be working with for years to come. And so maybe this is the direction we should all be going in. Until we get there, until we adopt some kind of framework, though, we're quite frankly stuck with the CSBG domains that we have to work with. These are dictated by law, by the rules and regulations. The state abides by those federal regulations and develops a statewide plan based on them. But for decades now, we've been looking at these 7 domains: civic engagement or community involvement, education, employment, income and asset building, health and social and behavioral development, housing, and then we've got another one in the CSBG world for outcomes and services that cut across multiple domains. And I think we're familiar with what those are. And we're familiar also with another aspect that the federal government provides for us, and that is they give us performance indicators that we need to report on. This is our end game. This is the kind of stuff that local partnerships need to be reporting on each year. And so the system that the state creates, the software that the software provider gives us, we think all of these things need to be focused on this. Focus on getting us to where we need to be from start to finish. And if our end game is we've got to report on these national performance indicators, let's start collecting this data now. Let's start looking at these things now. And so for the last several years, what CBI, again, a consultant, and what other consultants have been doing in Wyoming is taking a look at those domains and coming up with data indicators for each one of those. All of your CNAs should do this, and to some extent they do. So I'm just spilling out here. Here are the data indicators that we've come up with over the years that address each of those CSBG domains. And by giving local partnerships a community needs assessment that looks at these, they can then use them and track along how they're doing, what needs to be changed, and what needs to be implemented so that we can improve things. Those are laid out, but we're not doing a great job of of connecting all the dots. We have this federal program, we have the state guidance, and we have local partnerships, and then we have consultants like CBI that are working on almost an outside tangent here of trying to say, look here, look at these data indicators as you plan for how you're going to address each of these CSBG domains. And the reason that we need to draw attention there is because within the CSBG program, this is how we do things. You've all heard about this theory of change where we come up with community action goals and we all follow community action core principles with Roma and with especially with Roma next uh, uh, level stuff. We should be focused on this stuff as part of our performance management. What services do we need to meet our local community action goals? What strategies can we implement? This stuff really can be connected together quite well within the CSBG domains. And rather than adopt any particular framework, we can at least learn how they work, where they map out an entire area, ecosystem, and then break it down into more manageable data indicators, start to look at their theory of change to figure out what needs to change in order to improve poverty in our local community. And so this is exactly what we should be doing. And so pulling it together from a data perspective is the key. It defines not just those final performance indicators, but you've all seen these services literally numbered and lettered. That's because they're associated with a particular domain. And so when we come up with a plan for an individual, we need to provide services to them. You'll find those services in our system categorized just like the CSBG domains are categorized. And so this is the area that we need to probe. This is the area that we need to flesh out and start to collect better data. Now, a few years ago, when CBI started taking a harder look at this for Wyoming, one of the first things we realized is that when we talk about mapping anything out, it helps not just to have a framework, but a taxonomy. And a taxonomy is kind of like an indexing system of all available services. And if you've got a complete taxonomy, you can use it for things like resource mapping in a community. You can go through that list and see, do we have this here or not? Is there a need for it here? And if so, how can we attract this particular service? But to get there, similar to having to have a framework, a taxonomy should be comprehensive and should be the kind of thing that all of us become familiar with. Now, there are tons of taxonomies when it comes to human services in this country. Health and Human Services has one. CSBG used to follow one that was sort of loosely tied to their domains. But the one that has really developed and become more robust over the last few decades is the taxonomy that 211 uses. This started out of Los Angeles County, and they've really mastered this taxonomy and have gotten so good at it that they have been licensing their taxonomy to everybody. All the 211s have been using this. And more recently, it's morphed into yet another kind of taxonomy, and they're calling it now the 211 Human Services Indexing. I love this. This is a very comprehensive way to map out all available services. And as we talk about where we're going with data, I think we want to keep this in mind, because not only is 211 a good partner for what we do, but they maintain a database that adheres to this taxonomy, and it's consistent with principles and expectations that are maintained nationally at the 211 level. And so this is good. This is actually a good place maybe for us to start to think about something that's already being used in Wyoming, is accepted in other states, And I'll tell you, it can be easily crosswalked into official data sources like the Census Bureau and the Department of Employment. And so it's good. This is something I'm going to be pushing you guys to look at. I've started to break this down, and I've actually been working on the taxonomy for a few years now. And if you can imagine this taxonomy being, first of all, comprehensive, but it breaks the human services world up into several broad categories. And then within each of those categories, it starts to get more detailed as you get down into the deeper levels. And so level one, basic needs, looks a lot like the CSBG stuff: food, housing, material goods, transportation, utilities. Can you pay my light bill? But at that point, the 211 taxonomy becomes much more robust than anything you've seen in CSBG. I've highlighted here on this chart in red the things that I frequently have seen in CSBG world, but a lot of the black stuff doesn't show up very often. A lot of the stuff that isn't highlighted in red is definitely things that there's a taxonomy number for in 211, but we probably don't have many services available there. At least we've not been tracking them within the CSBG domains. And so there's some work to be done here. There's some crosswalks that we have been working on that I've used with CSBG, but we need to work on those as a team to figure out, where are we going with this and how's it going to get there? Now, the last few meetings that we've had, I've been talking a lot about a data-driven, person-centered project, but someone on the phone here with us, the 211 folks, have started something very similar that we might be able to coordinate our efforts with. And it's the project that Casey's heading up, the Communicare or the CIE initiative that he is leading. But here again, what this is an effort to get service providers and maybe also communities and even the people they serve to get them on the same page so that we can talk about this stuff, so that we are talking about apples and apples, not comparing apples to oranges. And so this is a good program, and I don't want to hang you out to dry here, Casey, but I'd love to have you maybe share a little bit about this program, because I think it does have a strong parallel with what we're trying to do here. And if you're prepared to do that, would you mind telling us just a little bit about what 211 is trying to do here with the CIE program and where you are with it today?
Yeah, absolutely. So the CIE, I guess on the surface, it is a centralized technology system that will allow organizations to communicate care with one another. Traditionally the Wyoming 211 formula is, someone could refer to us and then we refer them out, and the onus is on the individual to follow through with referrals. This kind of rids some of that responsibility on them and places that more on the provider. And then we can monitor where these individuals are. Did they receive their services? When did they receive those services? Were they the right services? And we can essentially close the loop on those referrals. Some historical context with this, Wyoming 211, we have a large taxonomy that's used nationwide, as was stated. And we also have 10 years of relationships that we've developed within the community and over 2,800 partners within Wyoming. That's not all of them, but that's a lot. So we have a good starting place for this CIE. Um, I think a lot of people here are familiar with what we're doing, and I think that's why I was brought onto the data task force, so that when CSBG is picking their new vendor or client management system, we can pick these together and kind of build it in the way that we want. And one of the things I was pushing is that we use the inform language, as they call it, or the 211 taxonomy, so that we can have these discussions a little bit more easily, and we can share that data, and they're all using the exact same terminology. Was that good? Was that enough?
Yeah, no,
Okay.
That's like super awesome. And I just wanted to, Joe, we had a couple of people that had to jump off because they had conflicting 10 o'clocks, but
okay.
we'll record this. As we're recording this, I'll make sure they get the link. And for those of you that are just joining, one of the things that we wanted to push, and this is something, a conversation Cecilia Casey and I had, is also taking data that we've collected across various agencies and pushing them all toward a common framework. And we talked about that, social determinants of health. All of us are going to fall within, all of our data indicators are going to fall within those types of domains that you indicated at the social drivers or social determinants of health. So when we are talking to large groups, we can push data into that. So when we're talking to legislators, policymakers, funders, we have a comprehensive list. This is mapping at its basic level in our software. This is why it was so important for us to talk to Casey when we're, when Cecilia puts out that RFP for our software vendor, is ensuring that those APIs are available. So those are mapping. That's just a connector mapping on the back end. To me, it sounds complicated as hell, but to software engineers, it's not. It's just linking services and saying, oh, this goes here, that goes there. And so this is kind of the conversation that we're having, is once we can push the data to a central place where we're all collecting the same, our data metrics mean the same thing with a unique identifier, so we can talk about unique individuals, we can have a much better comprehensive idea of what's actually happening in the state. And so this is, it's just so cool to have everybody here being able to agree upon the framework of where we're going. And like I said, we'll this is just the beginning of this, but I'm really looking forward to how we're going to go. I do want to lift up a comment that Clint had in the chat, Joe, and he said, are there discussions on how the SDOHs tie into the human services value curve? I know that at national, it seems to be promoting it more in the last couple of years. It's also something that I see at the American Public Health Association focuses on as well. And he put a link in there. And I was just wondering if you had any comment about that. He said it doesn't so much help to identify indicators, but maybe more of a model to work towards culture.
Yeah, there's actually a lot out there, Clint. Thanks for sharing that. I think we need to explore that. I think we need to take a look at those things. So obviously a lot more work to be done. When I talked about those indicators, and I don't want to make you dizzy here, but I'm going to back up a few slides. When CBI put together their data indicators, what we went out, so for education, what we did is we went out and started tracking all the available information we could find with early childhood, likewise with public school enrollment and educational attainment. We have all of these now mapped out for every county in Wyoming, and we've been playing around with a dashboard that looks at those individually. And it's the kind of thing where I'm kind of excited to get to that point where we can, as a group, talk about data indicators, what really is the trigger for us needing to make some changes, because I'm seeing some differences from county to county in Wyoming. We're not all the same. And what one county struggles with, another doesn't, and what is a trigger in one place isn't in another. And so I think we're really going to be able to get a much richer, more satisfying look at what's going on with poverty as we start planning by focusing on data instead of just doing it the way that we've done it in years past. Let's focus on the data. What should we be changing? And so I'm excited about that.
Yeah, and I was also going to speak to Cecilia. Imagine how much easier this comes down to then when we start talking about community needs assessments and being
just gonna
yeah.
jump in on that. Yeah, like this would be these data indicators are really great to include directly as like a requirement almost for every county to collect within like the quantitative section of their CNA. This would be really excellent data markers to get a consistent comparison across the counties. And you know, of course, like you said, Joe, some of them aren't going to be like in distress for some of these indicators as like other places. each county's different.
Yep. Yep. And I'm seeing those differences based. Let me back up. I'm seeing those differences in a
Is
couple
Joe really
different
quiet
ways.
to everybody else?
Yeah, he got,
I may have hit the wrong thing. Can you hear me now?
Yep.
Okay, so I was trying to turn Cecilia up, and I think I shut my mic off. Sorry. So yeah, when we look at these things, we see differences in two ways across counties. One is from the objective data. There's literally more elderly people or more Hispanic people in this county than the other. But sometimes we're also seeing differences in like the penetration of SNAP benefits and WIC recipients. And we're seeing some inconsistencies there that you wouldn't think would be there given the demographics. And so what I'm hoping to do is to start look at where are the needs, where are the differences, and maybe start to scratch at those explanations. Why is it so different in Johnson County compared to Goshen County? And that's where I think we can start to use this information to then talk about strategy and reaching better outcomes. So I am pretty excited, and I'm going to make you dizzy and fast forward again here. I'm sorry. Um, but I want to move on because we really do have our focus mapped out for us. Uh, in the CSBG world, we're going to do it the Roma way. And for those of you that have been around for a while and know that there's a Roma next generation, that's applying data to the Roma cycle so that as we assess and plan and implement what we're doing it for a reason. We're doing it with purpose. We're tying needs to resources on a community level and doing that strategically. So this is where we're going. This is what we want to accomplish. And as we go there, we need to understand that the data isn't there just for data's sake. We need to comply with the law. We need to be transparent. We're spending taxpayer money. We need to be good stewards of it. We need, as managers of data, we need to be literate. And that means I'm going to challenge all of you to really grow your capacity as well as your organization's capacity to actually use this data. And so we do have some things defined for us. We do have a big picture in terms of what we're looking for. We need to have a vision that accommodates that and accommodates our desire to grow. Some of us are very early in this journey. Some of you are very sophisticated when it comes to data. There's a range of talent on this call and across the state. So we need to develop a system that works for everybody, that brings newbies along, that is tied to this CSBG system. And I think the way to do that is kind of a traditional strategic planning step. What are we trying to do here? I think we need a vision, not just a statement that says we're trying to do a person-centered, data-driven ecosystem, but a vision. Where are we trying to take this? And that vision then needs to be tied to specific goals. And these are the goals that I've put into a roadmap. And so what I want to do is get to work. I want to have a conversation about, where our vision should be. Susan and I have been kicking around this very briefly to think about, what's a good starting point to be talking about this vision. And so what she and I came up with the other day was a vision that reads as Wyoming CSBG service delivery and outcomes continually improve for individuals and families in poverty by creating and maturing a data-driven culture that provides greater efficiency and effectiveness for services, better accountability for outcomes, and transparent operations, and that all of this then leads to a broader collaborative, a comprehensive data culture that supports strong and vibrant Wyoming residents. And what I think Susan was thinking about when she added that tagline was, it's not just us out there. The hospitals and the others working with social determinants of health, like 211, could all be working together collaboratively here. And so we can start with this vision. I'm really just trying to plant the seed and start a conversation because we need to know where we're going. Why are we trying to develop a data-driven system? How are we going to get there? How will the system work? we need to talk about the vision. We need to talk about this roadmap, and then figure out who else do we need to get at the table, and let's start developing those common processes, a common intake form, common definitions of customers and clients and pre-clients and post-clients. And so we've got a lot of work to do. Let's start by dreaming a little bit and talking about that vision and the roadmap. So that's what I wanted to share to get us started with this conversation, Susan. I'm not sure, since we've lost a few people, how far we want to take this today, or whether we want to just leave that as the seed and circle back next time and talk about these. I'll leave that in your hands.
So what I would like to do is leave you guys with that vision statement. I know it's very long, and typically our vision statements are not that long. They may have separate, we might be able to look at these some different ways, but I want to leave you with that for those. Some of us are crock pot thinkers, some of us are Instapot thinkers. So I want to leave the vision statement with you and kind of look at this. In reality, there are two parallel goals that we're trying to do. At the end of the day, CSBG discretionary fundings are paying for this project, and it is going to be a CSBG focused outcome. But we want to do this with a bigger, as he mentioned, at a bigger end game at the end of the day, where all of Wyoming human services providers, healthcare providers, everybody comes together with a unique and shared idea about what data means in Wyoming and how we can come together and share that data. So I want to leave this vision statement with you guys. We will email the link to this recording. We will send out the vision statement. Joe will share the slides with us. We will also have, I talked about this last week, we have a Google Drive that we have started that has all of our materials in there. We'll start probably a Google Keep, so you guys can add ideas into this as we go. Joe, if you want to flip to the next slide. The next thing that we talked about is 2, 3, 4, and 5 are really closely related. So I want to leave that, or I'm sorry, go one more. Sorry, Joe. Once we look at our vision statement, we do need to review and revise the roadmap or our goals. I'd like us to come up with 3 or 4 strategic goals that we want to really focus on. One of the things that we have talked about is a shared intake. We've talked about shared community needs assessments. We've talked about shared definitions. I would like to see an agreed upon framework that when we push everybody's data, I don't care if it's 211, family resource centers, CSBG, community health, federally qualified healthcare centers, HUD, housing, when we push data forward, we have a framework in which to report and ask questions about. Joe showing the flow chart of client information. This is based on Nevada's ROMA around client entry. We assess them, we make a plan for them, we implement the plan, then we start looking at watching what happens, and then we report on it, right? So this is one way that we can do that. We would need to determine, in Casey, Cecilia, we talked about this in software development, Stakeforce. If we have a common intake and we're sharing data and we want to do it, we have to come up with a unique identifier. I think Sabrina talked about there might be 5 unique identifiers that we all might want to identify. CSBG doesn't use social security numbers. So, you know, we would want to come up with what are ways that we can identify unique identifiers so we can actually get a true unique count. These types of things are things that we all, in our goals, we want to make sure we can identify things that are positive. And so I want to be able to discuss those things at our next meeting.
FYI, let me interrupt real quick.
Yeah.
The national data team is currently working on a unique identifier across multiple systems as well.
And can you help me understand who the national data team is?
It's essentially
Is that the
a,
people that were at DataCon?
yeah,
Okay.
and that's being, oh, let me find up my email. That's being spearheaded. Doo-doo-doo.
Hey, Cecilia, while he's looking up that information, did you know Muska left NASCAST? Clint, did you know that?
That must have been recent.
It is very recent.
I knew probably about a week and a half ago. It was sad because I
Yeah.
was actually looking at her job description at NASCAS for a second.
Oh. Anyways, Clint, you did, I know you don't want to mention the diaper grant, but that's another example of combined data that was really critically important. Wyoming did not get the data grant, but that's another example of data that's being collected. Lindsay, you worked on the ACP. We collected a lot of data around that. How do we push that forward? And how do we collect a common or unique identifiers? Clint, any thoughts or, oh, sorry, Doug, did you find your information?
Yeah, that's being spearheaded by Paige Teagarden. She's essentially a software developer. One of the softwares we looked at, I can't remember which one. And then there's multiple entities from that DataCon that are associated with that at the national level as well as regional levels throughout the US.
So that's something we want to keep our eyes on. So those are kind of the things. So what we'll leave you with is the recording, the slides, the vision statement for people to review and wordsmith as necessary. Some common goals that we know that we have to work toward, right? We know that we want some shared visions, we want some shared resources, and what are the things that we're willing to come to the table on and share those things, right? So welcome back, Cy. That was a really quick accounting meeting. I didn't even know that you could meet with an accountant that fast. Joe, what did I miss?
I think we're there. Again, I guess I would challenge everybody to identify any potential stakeholders that we should be inviting.
Sabrina was going to try to work on somebody from the Family Resource Center. They selected a line to set up the Family Resource Center Collective, which is going to be their network, but they were just newly into the signed contract, and I don't think they've started that. I really think it's important that we get a line on board. Sheila Riceley is the one that's going to be setting up the collective, or we need them. They're going to be, and the reason why we need them so badly is half of their grantees are CSBG recipients as well. They're also working very closely with 211 on some of their data collection outcomes and things like that. We need to have them at the table. So if anybody has any weight to pull over there, let's get them to the table.
Susan, can I ask one question?
Of course.
I know in Wyoming, like, CSBG sits within health, which is awesome. I know in Utah, we have that within our workforce development, like the Utah Department of Workforce Development. And I know just because of that, I think we have WIOA on our minds all the time. So I'm not sure if you have any partners from whoever's doing your American Job Centers or your WIOA, but like CSBG eligible entities are by WIOA law required federal partners. And one thing that we're struggling with in Utah is they developed their own like internal referral loop system separate from what we had been working with around social determinants of health that 211 had partnered with. So we find that we have our requirement for WIOA kind of totally separate from what these social determinants of health are. So I don't know if there's a way to bring somebody from the WIOA world in to try to mitigate that, because I think this is amazing work, and I would hate for you to go all the way down and find somebody saying, well, your CSBG entities are required WIOA partners, so you have to go do this whole other thing.
That's a really good point, Clint. And I also, did you see in the weatherization newsletter that they just sent out about the new Green Works job programs around the Infrastructure and Jobs Act.
You know, I hadn't read that bulletin yet.
Read it.
I should.
There is a whole new thing in there that's going to go through workforce about getting job ready. I've been wanting to talk, I was connecting it to Snap ENT, and I think that needs to be more of a WEO. So I will do that and make a connection out there. Our workforce development director is leaving. So I don't know who's heading up that office now, Cecilia. You're kind of out of the loop right now for this month. So I will find that out, and
Yeah, I would keep Heather in the loop with that, with any of those communications though. I think.
okay, I will do that. I'll make sure that I do that. Okay, awesome. Thank you. I agree. Workforce services needs to be here for sure, especially with the infrastructure and with IIJA. I don't know how we're going to get enough staff and workers to fill the open jobs that are going to be available. So I always envision our clients would be perfect job training, get them employed in these high paying Davis-Bacon jobs, right? So
Although
anyway.
I want to rename it to being Kevin Bacon, but that's more entertaining.
You're such a dork. Actually, if it's anything like ARPA, they waived the Davis-Bacon wages for ARPA funds. But anyway,
Just to go back to the FRC, so are you wanting to use Sheila as that representative?
I don't know
Sure.
what the plan is for Align to set the network up.
Sure. So I'm part of that leadership team as well, and that is being funded by the Wyoming Children's Trust Fund, which is headed by Sarah Sarelson. I don't know, I'm assuming she would love to be part of this conversation, but
Well, I've reached out to Sarah about that, and she was like, it needs to go to the person who's working with the Align team. And she said Sheila would be the person, but if you can wear two hats, that would be awesome. I don't know if that's worth of work in there, but we really need to have that alignment piece. I don't know if they've determined software, if they've determined data, if they've recovered. I mean, I know that national requires certain standards and outcomes that they track. In Nevada, CSBG and FRCs work together on their programming and use the same software, but I don't know where they're at on that.
yeah, the only way they're tracking data is through the CIE. We're a foundational piece of that, and then the protective factors surveys as an exit survey.
So we would need to really kind of look at a crosswalk between them. And I'm really familiar with protective factors as well, and crosswalk those into domains, really.
Yeah.
Because there's 5. Okay. So that's kind of what I will send out a follow-up email with everybody on that one. And it was Empower. That was ours, no, that wasn't ours. That's not who we had.
No, I specifically stayed away from us doing Empower because of my conversations with Paige at DataCon and her inviting me to the data team.
Oh, okay. And so you're on that team?
Yeah.
Okay. All right. Well, then we'll chat about that. Does anybody have any final comments, questions for Joe before we wrap this up? I'll be sending out that doodle poll for our next meeting towards the end of February. When are you going to have a contract, Cecilia?
It's waiting on one more signature, so I should be truly live next week.
Okay, awesome. All right, any final comments, pushback?
This has been really helpful. I appreciate the ideas. This is exactly the kind of conversation that I think we need to have heading into this. So thank you all for your time and thoughts.
All right, I'll be on the lookout for that email.
I just want to let you know that you're all my heroes.
You're my wind, Clint.
Oh, we're gonna sing Bette Midler next time we get together.
We are. All right, we'll talk to you guys later. Bye.
Thanks, Susan.